So let's talk about the difference between an EMR and an EHR system. In some books, they would consider them the same thing, but they're actually quite different. So let's get to it. An EMR and an EHR system is a way to talk about electronic medical records. So anytime you've gone to the doctor, the dentist, the hospital, whatever, and your information is kept on a computer, they are using either an EMR or an EHR system. So you've probably had exposure to this in some way, shape, or form. In the dental department, you guys are using Dentrix in the clinic. You're using EagleSoft in class. In nursing, you guys are going to see these EMR programs when you go out on your clinical sites. They are really a huge trend now in healthcare. So let's talk about how they are the same, and we'll talk about how they're different. So EMR stands for electronic medical records, and EHR stands for electronic health records. I don't know why that does that, sorry. Both of them utilize technology and a computer to be able to track patient records, but how available those records are to other people is really the big thing that sets them apart. So we're going to start by talking about EMR. So EMR is a digital version of a paper chart. So a patient's demographics, their progress notes, if we're talking about just a general physician, lab work, x-rays, their med list, stuff like that, appointment history, all that kind of stuff is going to be in the computer instead of being in a paper chart. And it's just for that one specific office, though. So if you go see Dr. Jones and Dr. Smith, and they each have an EMR system, Dr. Jones can only see your records for Dr. Jones. He can't look at Dr. Smith's stuff without Dr. Smith's office sending them to Dr. Jones. So what's great about an EMR system is that you can track information over time. So for patients, when you want to watch their blood pressure over a period of time, you can actually have the EMR system create like a line graph for you so that you can show the patient where they've been high or where they've been low, or if you're tracking weights or things like that. Dentally, maybe you want to track probe readings over time for a particular tooth or decay or a periodontal rating or something like that, and you're able to do that. You're also able, through an EMR system, to figure out when patients need something. So dentally, in Dentrix, you can run a report to see who's due for their 6-month follow-up cleaning. Medically, you can look and see how many women over the age of 50 need to go get their mammogram because they haven't gotten it done yet. So you can actually be a little bit more proactive with your patient care, and you're able to monitor things in a way that you couldn't do with paper charts. So if I wanted to track a patient's weight over a period of time and I was in paper charts, I'd have to look at every single piece of paper in that chart and then physically create that line graph or bar graph or whatever. And that takes quite a bit of time. So EMR really uses informatics to be able to take that data and manipulate it for both the office's use and for the patient's. So here are some good things and bad things about an EMR system. It's great because it's definitely faster, and it takes up less space, and there's less room for error, because in an EMR system, especially like for medications, let's say, if you have a patient who is on a blood thinner and you want to prescribe them aspirin, which is not a good thing because aspirin thins the blood, the EMR system will yell at you and give you all these warnings and say, no, are you sure you want to do that? Those two medications will react with each other. They'll contraindicate. So the EMR system creates a kind of check and balance for the healthcare person that a paper chart can't do. Believe it or not, an EMR is actually cheaper in the long run. It's more expensive in the beginning because you have to buy the computers and you have to buy the software and things like that, and you have to have an IT person, but it's cheaper than having to constantly buy the charts, buy the paper, buy the stickers that go on the charts, the labels that go on the charts, the human who has to photocopy all the papers that go in the charts, the time it takes to prep the charts for the next day, to file them, to put them away, to pull them. There's a lot more manpower involved in physical charts. So an EMR is actually cheaper in the long run. The most important the biggest difference between the EHR and the EMR is that the records are not easily transferable. So the physical preparation of records is the biggest deal or the biggest con with an EMR. Because remember, I was saying with an EMR, if you see Dr. Jones, Dr. Jones's EMR system only allows him to see the records that he has done. So if he wants your stuff from Dr. Smith, he's got to call over there and then wait for them to fax the stuff over. So it's probably happened where you've been in a doctor's office and they want to see your x-ray from wherever, and you have to sit and wait while they call for it, and it takes too long, and they say, well, the results aren't here yet, why don't you go home, we'll call you when the results are in. You get all the way home, they finally get the results, they call you, and now they want you to have some kind of prescription, so now you gotta go back out to the pharmacy. It's a pain in the butt. That physical preparation and the physical moving of records is the biggest disadvantage to an EMR system. Even though when the power goes out, it's tough to make accommodations when all your information is electronic. Really, the biggest issue is that physical preparation of records to move them back and forth for a patient. It takes a lot of time. So there are a lot of EMR programs, and a lot of them are specialized for different things. So in dental, we have Dentrix, we have EagleSoft, and EagleSoft is very popular. There are programs that are just for optical. There are programs just for orthopedic. But general healthcare EMR programs, Epic is your Cadillac of EMR systems. So you know how you can buy a car that has a cloth interior and power windows and a CD player, and it still works. It gets the job done. It drives you from A to B. Epic is the car that has the leather seats, the sunroof, the navigation system, the chick who talks to you through your touch screen, the remote start. It's got all the bells and whistles. So it still does the same thing, plus it does more, and it's more expensive. So Epic is more expensive, but it really is the Cadillac of the EMR programs. It does the best. Okay, so these are just some more pictures of different EMR programs that I stole off Google. These are not actual chart pictures, because if I showed you actual chart pictures, I'd be violating HIPAA, and I don't want to do that. But a lot of people like to point out in this picture that this is, I forget her name, something Fox. Not Vivica Fox. Megan Fox. But it says that her name is actually John Aaron, and that she is 81 years old. Okay. So, that's an EMR. So, in EHR, it's like that car with all the bells and whistles. It does what the car with the cloth interior does, but it also does a little bit more. So, an EHR does every single thing that an EMR does, but it also does more. So, in EHR, it does the patient tracking, it does all of those same things. It's got the patient's record digitally, blah, 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 blah. But the big difference is that an EHR system encompasses more than just one physician's records. So remember the example of Dr. Jones and Dr. Smith. And if I'm at Dr. Jones's office and he has an EMR, he cannot see the stuff Dr. Smith did. Well, if they both have an EHR system, when I'm sitting in Dr. Jones's office, he can actually look in the chart and see the lab orders that Dr. Smith did, or the x-rays that Dr. Smith ordered. So now there is no physical preparation of records that have to move back and forth, and that's a really big deal. It saves a lot of time. It saves a lot of manpower. So having an EHR is a really huge advantage. Geisinger is a great example of this. Physicians Health Alliance. If you see more than one doctor within Physicians Health Alliance, the records automatically populate. So, for example, my family doctor and my girly doctor are in Physicians Health Alliance. I don't have to have records sent back and forth to each other because they can both go in my same one chart and see, you know, the girly stuff that I had done, my lab work, that kind of a thing. Another capability that an EHR has is it allows the patient to access their own records through like a portal. So again, Geisinger is an example of this. And to keep everything safe, if any of you have this, you would have gotten a particular website with a pre-done password, and everything is secure. And you can go on there as a patient and you can see your own records. You can, if you're tracking your weight, you can log in your weight. You can add to your record. You can make appointments. You can talk to the office. You can email the doctors. It's got way more capabilities. So again, it's like that car that has the leather interior, the sunroof. It essentially, the nuts and bolts of it does the same thing, but it has way more capabilities. In this case, that make healthcare a lot more foolproof and a lot more patient-centered, where it's about the patient and not about the time it takes to move records back and forth. So here are some advantages that we kind of already talked about. Again, it allows for more patient-centered care, which means that visit is all about the patient. Now, because I don't have to run and get the records from Dr. Smith's office, I can spend that time just looking at Dr. Smith's records and talking to the patient about the results and what they want to do with things, and they can have a more active role. It also really helps reduce the duplication of things. So for instance, in an EMR system, you know, Dr. Jones might order a certain set of blood work, and then a month later, Dr. Smith orders another set of blood work, and the normal patient doesn't know what certain lab tests are and doesn't realize that certain lab tests can be duplicated. And then an insurance company will only pay for a certain lab test every so many months, so then the patient gets whacked with this bill and they don't know why. An EHR system, it allows the doctors to see that that lab work has already been done, so I don't need to order it again. Or that x-ray was already done, I don't have to order it again. So it's really, really beneficial. And there's also way more communication, especially among ERs and hospitals. In a private medical facility, and this is more medical than it is dental, but in a private medical facility, when a patient goes to the ER, that small doctor's office is never notified. The records from the ER don't automatically get sent. The only way that a private practice physician ever finds out that their patient was in the ER is if the patient actually calls and tells them that they were in the ER, or if the ER doctor calls because they need to admit the patient or something like that. That's the only way we find out. In an EMR system, however, like for Geisinger, if you go to the Geisinger hospital and you're seen in the ER, those ER records become part of your chart. So your physician can see that you were at the ER yesterday and can follow up more properly with you. So it really helps communication among doctors and specialists so that a patient is treated better medically, not when it comes to being nice or rude. So here are some different ways that you can access either of these systems, obviously through laptops. There are apps on smartphones now. Medent has an app on a smartphone, so you can access that EMR system from your phone. But of course, then because you can do that, you have to set special securities to your phone so that if it gets stolen, nobody can break into that app and get any medical information. Blackberries and PDAs are really dying away, but you never know, people might still have them. people like EMRs. Hey, look, people like EMRs. This I like. Now, unfortunately, this only looks at medical specialists. It doesn't look at dentistry. But this was a survey that was done in 2012 to see how much time, on average, per day, each specialty saved by using either an EMR or EHR as opposed to using paper charts. So the average was an hour. So, that's the difference between going home at 5 o'clock and going home at 6 o'clock. That's the difference between getting a lunch or not. And orthopedics saved 75 minutes a day. I mean, that's obviously, over an hour, but, that's the difference between going home at 4 and going home at 5:20, which doesn't seem like a lot, but at the end of the day, it can be. So it really does save time. Okay, so regardless of whether you're using an EMR or an EHR, these are some overall advantages. Because you're typing things, look at how old this is. I think that's funny. But because you're typing this stuff, it's easy to read. So we don't have to worry about reading someone's handwriting and misinterpreting it. Because it's on a computer, everything gets time-stamped, just like when you guys send an email and the date and the time gets attached to it. When you work in an office that has an EMR or an EHR, you get a special login and password, and your initials are automatically tied to everything that you do. There are auto locks, so that if you walk away from the EMR program within a certain amount of time, it'll lock out, and you have to put your password in to get back in. It's very accessible. You're able to pull records faster. You can search for things easier. And it does create an IT position, which was great for me when I became the IT person. But here are some disadvantages. A couple of the biggest disadvantages that patients tend to complain about is that it's very impersonal, and impede means block. So some of you might have experienced this when you're at the doctor's office and the clinician is more concerned with what they're typing on the computer than you, or they have their back to you because they're typing on the computer. That's a big patient complaint, that using these EMR, EHR systems really prevent that human contact. In some cases, you have to, in finding that balance, you have to find the time to document stuff. I worked with one physician who refused to take a computer into the office, into the visit with him, so he would come out and then go right in with the next patient, and he would have to find time at the end of the day to write the progress notes and fill in the diagnosis codes and things like that. Which means that visit cannot get billed until he puts in the diagnosis codes and writes the progress note. On average, he was like 8 months behind in his notes. So he would have to sit down and do 8 months worth of patients, and his memory was amazing. He would remember exactly what happened in those visits. But he'd have to find the time to do the documentation. It is difficult to figure out what to do when the power goes out, and it doesn't mean you get to go home. You still have to operate and see patients. So this thing down here says you need to establish a clinical information system, which is normally known as a CIS. A CIS is a fancy way of saying that the office makes a game plan of how they're going to run their office now that they're using computers instead of paper charts. So maybe one of the policies is that at the end of every day, the next day's list of patients gets printed out just in case this happens, or just in case there's snow, or something like that. A CIS might state that, the nurse will fill in 3/4 of the progress note and leave the physician with a smaller portion so the physician can spend more time with the patient. It's basically, how do we run our office now that we're using computers? And of course, we have to make sure that we protect people's privacy, and everything needs to be secure and maintained and virus-free. I worked for the same physician who was like 8 months behind in his progress notes. He had like 12 kids, and he used to let them come in the office and play on his computer, and they would download videos off YouTube of like the Muppets and stuff because they were little. But they opened a video that had a virus, and it infected the entire network. So there were 12 physicians in our corporation, and all 12 physicians plus nurses plus secretaries plus everybody in the whole corporation got infected with that virus, and he got into a whole lot of trouble. Hey, look, people like EMR. These are some ethical or legal issues that come up with using an EMR system, which I think we've really talked about already, is that you have to make sure patient stuff is protected and that it stays confidential. There's a thing called a joint commission. If you're in the nursing class, this is in your textbook. If you're in the hygiene class, don't worry about this at all. If you're in the nursing class, the only reason I put this joint commission stuff in this PowerPoint is because it's worded quite confusing in the textbook. But basically, there's this group of people who created standards for using an EMR system. That's kind of all you need to know, just to keep people safe. And you don't even really need to know that. But just in case you didn't understand it in the textbook, I explained it for you in some human terms there. Hey, look, people like medical records on a computer. So here are some extra things that using informatics in an office can let you do. You can use email, which through the portals, patients can email clinicians. A lot of offices utilize cameras to take pictures of the patients, so that'll reduce identity theft of insurance cards, which actually happens. You might have seen scanners where they scan your insurance card, or they have a document scanner where they scan the actual documents and then it goes right into your chart. ERX, this means e-prescribing. So what e-prescribing is, instead of faxing a prescription to the pharmacy, an ERX is like sending a prescription through a text message. It's absolutely instant, and they kind of collect in a pool, like an email almost. They kind of collect in a email inbox at the pharmacy, so the pharmacy can get the prescriptions faster. There aren't issues with, a fax number being busy and things like that. Barcode scanners. If any of you have been to or in a hospital, you know that you get a barcode and you get scanned like a piece of produce, and so does the bag of medication you're going to get and stuff like that. Touch pens used to be a big deal before touch screens came out. There's also dictation software. So for those of you who hate to type but have to write papers, you might like this. There's something called Dragon Naturally Speaking, where you get the software program. I actually have it. I have it on my phone too. You talk, it types. It just takes a little bit to train the program to get used to your voice and how you speak and things like that. The final thing I have on here is called Import RX History, and I have it in quotation marks because this is what it's called in MedEnt, which is the EMR program I'm most familiar with. But it's called other things in other programs. Basically what this does is, as a clinician, I can click on this and it will show me all of the prescriptions that a patient has, when they've been filled, how many refills, when the refills were done, what doctor prescribed it, and the diagnosis for why the medication was prescribed. So this is great for when you have elderly people who say, well, I take a blue pill in the morning and I take a pink pill in the afternoon, and they have no idea the name of the pill. So it's helpful for that, but it's also very helpful for narcotic seekers. People who are looking for prescriptions for Oxys or Actique or Demerol or things like that. You could actually see how many different physicians are prescribing what medications. Hey, look, people like EMR. One of the things, though, on this left side, these are just some of the EMR systems that exist. And if you notice, the dental ones are not on here. These are just medical ones in general, and these are just some of them. So we talked about informatics, and in healthcare, EMR and EHR systems are really at the heart of informatics. They're one of the biggest ways that informatics is utilized within an office setting, a dental setting, anything like that. And there are people who work in informatics who keep trying to figure out more innovative ways to better serve patients. A while ago, patient portals didn't exist where patients could actually access their own records. That was something that hasn't happened in a while. So the biggest difference between an EMR and an EHR system is that preparation and moving of records. So in an EMR system, someone has to actually gather records together and fax them to another office for them to see them, whereas with an EHR, everything's right there in front of them. So that's really what I want you to take away from this. Black screen, end of the PowerPoint. I know you love it. I hope you learned something. Feel free to ask me questions. See ya.